Hi, everybody. Today we're going to talk about the powerful role of nitrates and nitric oxide in intestinal health. So nitric oxide, the miracle molecule, is made through two different pathways in the body. The first pathway is the arginine NOS, nitric oxide synthase enzyme. Takes arginine and oxygen, oxidizes it to nitric oxide, and then further oxidizes it to nitrate and nitrite. And then there's a nitrate pathway. We consume the nitrates, they get absorbed and concentrated in the salivary glands. The salivary glands release the nitrate, and we've got good anaerobic bacteria on the dorsal aspect of the tongue that will reduce that nitrate to nitrite. And then we swallow the nitrite, and in the acidic environment of the stomach, some of that nitrite gets reduced further to nitric oxide, but most of the nitrite gets absorbed and acts like a nitric oxide reservoir. And we have, in the different tissues, we have different nitrite reductase activity that will be able to reduce that nitrite to nitric oxide on an as-needed basis, like in the myoglobin, in the electron transport chain. Hypoxia stimulates these pathways. But this pathway needs to be optimized because as we age, the arginine NOS pathway decreases. So as we age, us women can hold on to our nitric oxide production capacity better than men. Estrogen stimulates eNOS to make nitric oxide. But once we hit about the menopause years, our production of nitric oxide kind of equals out to men. And this is why once menopause hits, cardiovascular disease skyrockets. And once women hit about 85, probably a good 85-90% of the women are hypertensive. So endothelial dysfunction is directly connected to our ability to make nitric oxide. By the time we're 40, that ability decreases to about 50%. By the time we're 60, it decreases to about 15%. So that's why supporting the nitrate to nitrite to nitric oxide pathway is critical. So what are the current factors affecting nitric oxide formation? We talked about aging, and then there's the diet. The standard American diet, devoid of nitrate-rich veggies. The exercise or the lack of exercise increases nitric oxide production. Then there's medication, antibiotics, antidepressants, birth control pills, NSAIDs, your aspirin, your ibuprofen, and PPIs, proton pump inhibitors. Proton pump inhibitors inhibit the production of nitric oxide through both pathways. Pollution, anything that increases oxidative stress, will increase the uncoupling of the NOS enzyme. So when the NOS enzyme is uncoupled or dysfunctional, it becomes a superoxide generating enzyme instead of a nitric oxide generating enzyme. And superoxide uncouples that NOS enzyme even more. Genetics, and not just your NOS SNPs. Anything that influences oxidative stress. You've got your SOD SNPs, your catalase SNPs, your HFE SNPs, anything that interferes with production of BH4, your QDPR, your DHFR, MTHFR. If you have any MTHFR SNPs, you are by definition nitric oxide deficient. And then the big one, stress. Stress inhibits the production of nitric oxide. So why is nitric oxide essential? It regulates all cardiovascular functions and homeostasis, optimizes circulation and microcirculation, allows the glucose, the nutrients, the oxygen to be able to be delivered to the cells and tissues, and the debris to be carried away. It's critical to sexual function, vasodilation, and innervates erectile tissue in both men and women. Red blood cells require adequate nitric oxide in order to deliver oxygen to the cells. Supports neurotransmitter function, regulates gastrointestinal function, including gastroparesis, mucus production, digestion, healthy microbiomes everywhere, helps activate the GLUT4 receptor in order to translocate and bring glucose into the cell. It controls the efficiency of the mitochondria in the generation of energy and the generation of hormones. This is where pregnenolone starts to be metabolized into the other hormones. Stem cell mobilization and differentiation. So nitric oxide is essential in order to tell the stem cells where to go and what to do. And stem cells are essential for any healing to take place. Regulates the immune system, regulates the inflammatory response and scavenges free radicals, modifies platelet activation and aggregation. This is the clotting factor. Supports telomerase activity, which is at the crux of aging. So the intestinal health. The gastrointestinal tract is a complex balance of microbes, hormones, neurotransmitters, and enzymes. A healthy gastrointestinal tract, all of these things are balanced, and this is extremely important for longevity and well-being. A rich, diverse intestinal microbiome is essential to mental, intestinal, and overall health and well-being. Gastrointestinal system controls physical wellness as well as mental well-being. And this is that gut-brain connection, the communication between the intestinal tract and the brain. And we all know people that have messed up guts and how this affects their brain, from depression, anxiety, foggy thinking. And then when there's injuries in the brain, like there is consequences in the gut, like TBIs. You will form dysbiosis and leaky gut with TBI injury. The intestinal microbiome influences metabolic pathways, immune pathways, genetic and epigenetic factors, and dysbiosis is this disruption of intestinal microbial ecosystem and is associated with all sorts of conditions like gastrointestinal, neurological, cardiovascular, respiratory, metabolic, and oncological diseases. So the CDC says that 5 out of 6 people receive at least one antibiotic prescription per year, which leads to alteration of the microbiome and increased dysbiosis. So if you're like me and you don't receive any antibiotics, that means there's a lot of people that receive more than one antibiotic per year, increasing dysbiosis and leaky gut. So nitrates support the nitrate to nitrite to nitric oxide pathway, promotes GI health, is correlated with healthy oral, gut, and intestinal microbiome. So it's also, there's studies showing that the nitrates also support the microbiome everywhere, like the skin microbiome, the vaginal microbiome, the urinary tract microbiome. The nitrates support healthy microbiomes. Supports the gut-brain axis, prevents dysbiosis, protects against LPS toxicity, protects against leaky gut, modulates inflammatory, immune, and oncological pathways, and maintains homeostasis. So this is what the this is the effects nitric oxide has on the mucus lining. So nitric oxide increases mucus secretion. Nitric oxide increases formation of new blood vessels, vasodilates the vasculature, accelerates wound healing. Nitric oxide inhibits and reduces the degranulation and mediator release of the mast cells, decreases the histamine release. Nitric oxide decreases the cytokine release from the macrophages, the interleukin 1b, the interleukin 18, interleukin 6. Nitric oxide reduces the adherence and secretion of the neutrophils. And nitric oxide decreases oxidative stress, reduces the superoxide free radicals. So nitric oxide protects the gastric mucosal lining. The mucus is our first line of defense against pathogens. The mucosal lining is the critical protective layer to balance the good and harmful bacteria. And this mucus lining is exposed to many damaging substances: alcohol, nicotine, drugs like NSAIDs, H. pylori, hyperosmolar solutions, bile salts, ischemia, reperfusion of gastric tissues, and the big one, stress. Nitric oxide is an essential signal for mucus secretion. It's the mediator responsible for cholinergic stimulated mucus release. Nitric oxide increases the mucosal blood flow, diluting toxic substances and neutralizing them and removing them before accumulation to damaging concentrations. Supporting the nitrate to nitrite to nitric oxide pathway increases mucosal blood flow and vasodilation, increases mucus production and thickness, modulates mucosal immune response, prevents acute peptic ulceration, repairs NSAID damage to the intestinal tract. In fact, there's a new class of nitric oxide releasing NSAIDs. And these can inhibit the COX-1 and COX-2 and prostaglandin E2 generation without causing mucosal damage. So they've known how to modulate the damage that these NSAIDs have caused. Nitric oxide and the intestinal barrier integrity. So the tight junction proteins, these are important for epithelial transport. They're responsible for the barrier integrity of the intestinal tract. So these tight junctions you want them to stay together so things can't slip through into the blood. So the loss of tight junction proteins cause a breakdown of the barrier and leaky gut. And during dysbiosis, you have decreased expression of tight junction proteins, the occludin and the claudin 5. However, nitrates given during dysbiosis supports the rebound levels of occludin and claudin 5, thus decreasing leaky gut and protecting that barrier integrity. So the BDNF, brain-derived neurotropic factor. This has homeostatic regulation of that intestinal barrier integrity. It affects the expression of these tight junction proteins. IBS has decreased BDNF, irritable bowel syndrome. But BDNF also has a major role in depression, anxiety, learning, and memory. And nitric oxide is an essential mediator of BDNF. Antibiotics and nitric oxide. Broad spectrum antibiotics decrease microbial richness and diversity. This is linked to intestinal disorders, leaky gut, mental health issues. Here's that: anxiety, depression, brain fog, fatigue from disturbed microbiome. This is important. Nitrates taken during antibiotic therapy will downregulate gastric mucosal inflammatory pathways, prevents overt inflammation and the resulting increased intestinal epithelial permeability. Nitrates increase the microbial biomass, act as a substrate for existing microbial communities, and prevent dysbiosis. So I recommend anybody taking any kind of antimicrobial, whether prescription or even herbal, to take nitrate supplement with this to prevent dysbiosis and protect the microbiome. The oral microbiome modulates the gut microbiome. We're constantly seeding the intestinal tract every time we swallow or eat or drink. Approximately 45% of the bacteria in the oral cavity and large intestine overlap. And having dysbiosis of the oral microbiome, this is connected with cardiovascular disease and ill health. Nitrates prevent or reduce bacterial dysbiosis and stimulates eubiosis. Nitrates increase the nitrite reducing bacteria on the tongue. So with continued nitrate supplementation, you are actually rebuilding your oral microbiome. Nitrates decrease levels of bacteria that are associated with poor oral health, restores local immune and inflammatory responses, and protects the gut microbiome under inflammatory conditions. There's some studies showing that nitrite can be used as an alternative to standard antibiotic therapies. Nitrite will disrupt the biofilm that these bacteria put out. And there's studies using nitrite and vitamin C for persistent chronic urinary tract infections, allowing them to clear up where regular antibiotics just don't cut it. So the infections in the urinary tract are known for having these biofilms, and the nitrite is allowed to get in there and take care of it. Nitrate, nitrite, nitric oxide, inflammation and immune cells. So nitrates rebalance the ratio of the T helper cells in the peripheral blood. They decrease the pro-inflammatory Th1 and Th17, and both of these are closely associated with inflammatory bowel disease. Nitrates decrease interleukin-17 in the colon, which decreases inflammation. Inflammatory bowel disease is a major risk factor for colorectal cancer. Nitrate may prevent colitis and colorectal cancer. Nitrates increase the Treg cells to maintain homeostasis and self-tolerance. So this is where the autoimmune issues come in. Nitrates decrease myeloperoxidase activity in the gastric mucosa, decreasing reactive oxygen species and decreasing tissue injury. So mast cells are white blood cells that are part of the immune system, and they function as a bridge between the immune system and the nervous system. But these mast cells become activated in the absence of nitric oxide, and increased superoxide production activates the mast cells. So when you have increased superoxide production, you are downregulating the production of nitric oxide. So here we've got a bad, vicious cycle. Increased oxidative stress, decreased nitric oxide, even more oxidative stress. But nitrites and nitric oxide regulate the activity of the mast cell. They inhibit the mast cell inflammatory events, suppresses antigen-induced degranulation, suppresses mediator release, including histamine and cytokines, inhibits the leukocyte endothelial cell attachment, and nitrates and nitric oxide inhibit generation of reactive oxygen species by mast cells. So these mast cells are important effectors of the gut-brain axis, translate the stress signals into the release of neurotransmitters and pro-inflammatory cytokines. So most of us understand that when our allergies are up and these mast cells are kicking out histamine, how our brains just don't feel right. We've got foggy brain, maybe fatigue, and these are this upregulation of this mast cell. So stress causes inflammation and damage to all cells, including the GI tract. Stress increases the cortisol production. Cortisol is a catabolic hormone, means it breaks down tissue, breaks down muscle, skin, bone, cells in the GI tract. So the stress will alter the GI motility, changes GI secretion. So it's decreasing that mucus production, that lining of the gut, increases intestinal permeability, decreases regenerative capacity of the GI mucosa and mucosal blood flow, has negative effects on intestinal microbiome. Stress by increasing the cortisol, this will increase the blood glucose, which tends to increase an overgrowth of candida, which alters that microbiome. So stress will decrease the production of nitric oxide through the arginine-NOS pathway. Stress decreases the iNOS production of nitric oxide, the inducible NOS, thus the impairment of the immune system. We know that when we're stressed, we get sick easier. And nitric oxide decreases the production of nitric oxide through the eNOS pathway, thus the impairment of the cardiovascular system, the high blood pressure. So nitrates address these multiple adverse effects of stress. Supporting the nitrate to nitrite to nitric oxide pathway can enhance mental health by improving sleep, decreasing anxiety, decreasing depression, improving the gut-brain axis, thereby affecting factors that can indirectly lead to impaired GI health. So can nitric oxide really damage the GI tract? It's very controversial whether increased nitric oxide from inducible NOS or any other source for that matter causes GI injury. There are questions around the role of peroxynitrite in the production of tissue injury, on whether is peroxynitrite really damaging, or is it something else that's in there that's doing the damage? So L-name, nitro-L-arginine methyl ester, is an iNOS inhibitor that is used in many studies. And in these studies, it shows that this L-name will decrease tissue injury and inflammation. However, this may not be due to inhibition of the production of cytotoxic concentrations of nitric oxide. There are other actions of the L-name that may be at play here. So this decrease in tissue injury and inflammation may not be due to decreasing the concentration of nitric oxide. So nitric oxide and nitric oxide donors, which nitrite is a nitric oxide donor, can protect gastric mucosa from damage from alcohol or NSAIDs. Oral nitric oxide donors accelerate ulcer healing. Nitrite and nitric oxide inhibit NADPH oxidase, decreasing superoxide production and oxidative stress. So it has been shown that large amounts of nitric oxide does not cause detectable damage to the mucosa or vasculature of the intestine. And the majority of the available data points to nitric oxide serves a critical role in protecting the GI mucosa from injury induced by reactive oxygen species and other cytotoxic substances. So nitrates play an essential and important role in protecting GI health. They inhibit inflammatory process, downregulates oxidative stress, scavenges free radicals, decreases inflammation, downregulates iNOS, which is common in inflammatory bowel issues. It's a powerful modulator of the microbiome, prevents dysbiosis, prevents leaky gut, promotes a healthy gut-brain axis, modulates immune and oncological pathways, and maintains homeostasis. Thanks, everybody. Any questions?